be advocates for prevention of these different conditions. And here we are. So we want to see those challenges in school and in schools and how we can address them, who is responsible, how do we go about them. I'm not the right person to talk about all that tonight, but I want to welcome our guest tonight, that is Dr. Ahimbisibwe James from Keah Medical Center, to take us through why do we even have challenges in school in the first place.
Thank you, viewers, and thank you, moderator. And I want to bring this to the attention of our fellow Ugandans, that everything starts by lack of knowledge. There are so many things that takes place within our country, within our communities where we live, not just because we have a wish, but just because we don't know how they are supposed to be done. First of all, I think I should regard myself as someone who has got a soft spot to the children and school-going children. First of all, before we go even very far out of this, before every parent thinks about taking as a kid, a child, back to school, you should first have this question in your mind. Are you taking to school a patient or someone who will be capable of ingesting each and everything that the students or the school will be teaching? First of all, there's no way how, as a teacher, that you can manage really to teach enough a patient. So before you start thinking about taking this student to school and moving up and down with school fees, hurdles, and all these, and requirements that really the school that has requested, I should say, think about first taking this child to a health center which is preferably recognized, which is preferably has got all what it takes in terms of requirements and the capacity and the human resource to examine this child and certify the child that this child is healthy enough to go and spend 3 months or more at school within another community. Now, this starts by looking at either this child you're taking to the health facility, a doctor may end up screening this child. One, the child may be found with non-communicable diseases. The child may be found with infectious diseases, what you call communicable diseases. Or maybe your child has been battering up and down with allergen-related diseases that may be as well handled before going to school. And this definitely will be a relief to the school itself, school administration, school dispensers.
I want to take you back, Doctor. You are mentioning and saying that a parent is taking a child that is battling either non-communicable diseases or communicable diseases, the infectious diseases. But let's go back to the non-communicable diseases. During the conference today, they were emphasizing that the biggest contributor to someone being predisposed to these non-communicable diseases are the infections.
Yeah, they do contribute.
Other infections. But how I wish you could also help us break down the non-communicable diseases for our viewers. Because if you talk of non-communicable diseases, to me, okay, to maybe someone out there, they might think, because at first I will think of diabetes, hypertension, but just help us break them down for us. I feel that you can break down for people to be relating that, oh well, they're not only in the adults but also in our school-going children.
First of all, non-communicable diseases do not only attack adults. They can even attack neonates, the newly born baby. So what it takes is, and I want to inform the public that communicable diseases as in not all non-communicable diseases are led by the communicable diseases, but some do. And then at the end of the day, most of these non-communicable diseases come in and they communicate by definitely compromising the body immunity. Then the body immunity attracts communicable diseases. Most of them get attracted by your compromised immunity. I don't know that I'm got clear here. Now, first of all, like the most common non-communicable diseases that we can really talk of, that really cut across, maybe we may start with the diabetes. And this diabetes, I should even inform everyone hearing us that diabetes can attack even a child at whatever age. And when it goes, some people get diabetes as early as before 30 years, and others get diabetes after 30 years, which we call the lifestyle diabetes, the type 2. Then we have also hypertension. I don't see any hypertension in any infectious diseases leading to hypertension unless otherwise. Then other non-communicable diseases maybe would be looking at other categories of cancers. But then when we talk about now, like to the females, this is so-called cancer of the cervix and the uterus and all that, whenever the body's immunity is compromised because there is a big man called cancer, then the recurrences of urinary tract infections will definitely be coming up. And at the end of the day, you're battling up with a disease you don't know. Because every time and again, every month, every week, you are at the health facility and still a doctor is treating the same disease. So what we are saying is you need to wake up, go to the health facility, get checked up by the healthy, qualified health worker. Because it is up to the health worker that knows the signals that the disease is present on you. And at the end of the day, we'll definitely give you an alert and say, hey, can't we investigate for this? Can't we investigate for this? Can't we do this?